Have you ever wondered what a severe asthma exacerbation is and why it can be life-threatening? Let's dive into it. Imagine your bronchial tubes, the airways that carry oxygen to your lungs, as a set of flexible pipes. In a healthy state, these pipes are open and clear, allowing air to flow freely. But for those with asthma, these pipes can become inflamed and filled with mucus, a sticky substance that clogs up the tubes. Now, picture a severe asthma exacerbation as a sudden and intense storm inside these pipes. The inflammation intensifies, the mucus multiplies, and to make matters worse, the muscles around the bronchial tubes tighten up, a process known as bronchospasm. It's like the storm is causing the pipes to narrow and stiffen, leaving only a tiny passage for the air to squeeze through. In simple terms, a severe asthma exacerbation is a violent asthma attack that almost completely closes the bronchial tubes. But why almost? Because if the tubes were to close completely, it would be a total respiratory failure, a fatal condition. In a severe exacerbation, there is just enough opening left for a small amount of air to pass, but not enough to sustain normal breathing. The person experiencing this is gasping for air. It's like trying to breathe through a straw while running a marathon. The lack of sufficient oxygen can lead to severe health complications, even death, if not treated promptly. So, in essence, severe asthma exacerbation is a condition where the bronchial tubes almost completely close due to inflammation and mucus, making it extremely difficult for air to pass through. It's a state of emergency that requires immediate medical attention. Now that we understand what a severe asthma exacerbation is, how can we identify it? Imagine you're faced with a patient who might be experiencing a severe asthma attack. What signs would you look for? The patient might not even be able to communicate verbally due to the severity of their condition, but their body language and physical symptoms will tell you everything you need to know. Start with their breathing. Is it rapid, over 30 breaths per minute? Is it accompanied by a wheezing sound? These are classic signs of an asthma attack, but we're talking about severe exacerbations, so we need to delve deeper. Look at the patient's neck. Are the muscles contracting, straining with every breath they take? This is known as retraction, and it's a sign the patient is struggling to get enough air. Now, look into their eyes. Do you see fear, panic? That's because the body instinctively knows it's not getting enough oxygen. Even if they can't tell you, their eyes will give them away. Their speech, or lack thereof, is another telling sign. Are they able to string together more than a few words at a time? If not, it's because their body is prioritizing breathing over talking. Lastly, listen. Are the wheezing sounds very noisy, or is there an ominous silence? This silence might mean the bronchial tubes are so blocked that no air is getting through. This is a critical situation and requires immediate intervention. So let's recap. Rapid, wheezing breaths, neck muscle contractions, fear in their eyes, difficulty speaking, and very noisy wheezing or silence. These are the key signs of a severe asthma exacerbation. Recognizing these signs is crucial for early intervention and potentially saving a life. And remember, every second counts in an asthma attack. So, stay alert, stay informed, and be ready to act fast. Knowing the signs is half the battle, but what actions can save a life during a severe asthma exacerbation? In the heat of the moment, it's crucial to remember that every second counts. The first step is to administer high-concentration oxygen, around 12 to 15 liters per minute, to increase the patient's saturation level between 94 and 98%. This can provide immediate relief and buy some precious time. Next, it's vital to set up monitoring for the patient. This includes electrocardiograms, blood pressure tracking, oxygen saturation, and establishing a venous access. This allows you to keep a close watch on the patient's vitals and respond quickly to any changes. Now, let's talk about medication. Rapid-action bronchodilators, particularly beta-2 agonists, are your best friends here. Administered continuously during the first hour, they help to relax the muscles around the airways, making it easier for the patient to breathe. In tandem with bronchodilators, an anticholinergic can be administered. This type of medicine further helps to open up the airways by blocking certain signals that might cause them to constrict. Don't forget about corticosteroids either. While they might not be the most urgent medication, they're indispensable within the first hour to calm the inflammation in the airways. But what if the patient shows signs of exhaustion, such as confusion, slow heart rate, or breathing pauses? In such cases, immediate intubation may be necessary, and you should alert a resuscitation team right away. Every asthmatic patient is unique, and their body may respond differently to treatments. Hence, it's crucial to continuously monitor their condition and adjust the treatment plan as needed. Remember, time is of the essence, and these actions could make the difference between life and death. What examinations can help in diagnosing a severe asthma exacerbation? To understand the severity of an asthma exacerbation, there are two key examinations that provide invaluable insights: blood gas analysis and radiography. Starting with blood gas analysis, it's a test that measures the amount of oxygen and carbon dioxide in the blood. In the context of a severe asthma exacerbation, it can provide a clear snapshot of how effectively the lungs are moving oxygen into the blood and removing carbon dioxide. If the levels are not within the normal range, it could indicate that the patient's respiratory system is struggling, and immediate steps need to be taken to address the issue. Another crucial examination is radiography, or more commonly known as an X-ray. This imaging test can reveal any potential complications that may be contributing to the exacerbation, such as pneumonia or a pneumothorax, which is a collapsed lung. It's essential to identify these complications early on to ensure the patient receives the appropriate treatment. However, these examinations are typically reserved for cases where there is doubt about the diagnosis, or if the patient is not responding well to initial treatment. Remember, time is of the essence in a severe asthma exacerbation, and these tests should not delay the commencement of treatment. Moreover, it's worth mentioning that while these examinations provide valuable information, they are just one piece of the puzzle. Clinicians should also consider the patient's symptoms, medical history, and physical examination findings when formulating a treatment plan. In the face of a severe asthma exacerbation, these examinations can provide crucial information to guide the treatment plan. They help in determining the severity of the condition, identifying potential complications, and ultimately guiding the course of treatment. But as always, the key lies in swift recognition and prompt action. These examinations can provide crucial information to guide the treatment plan. Finally, what are the common triggers that can lead to a severe asthma exacerbation? Well, they're as varied as they are numerous. Let's dive in. First up, allergens. Dust mites, pollens, pet dander, mold spores, and even certain foods can provoke a severe asthma attack. Exposure to these allergens can cause the body's immune system to overreact, leading to inflammation and narrowing of the airways. Next, viral infections. A common cold or the flu can escalate quickly in individuals with asthma, often resulting in severe exacerbations. These infections inflame and swell the bronchial tubes, making it even harder for air to flow in and out of the lungs. certain medications can also be a trigger. Non-steroidal, anti-inflammatory drugs and beta blockers, often used to treat conditions like high blood pressure and heart disease, can sometimes worsen asthma symptoms or trigger an attack. Gastroesophageal reflux disease, or GERD, is another common trigger. This condition, where stomach acid backs up into the esophagus, can lead to coughing and chest pain, both of which can trigger an asthma attack. Tobacco smoke is a major offender, whether it's first-hand or second-hand. Smoke irritates the airways and leads to inflammation and mucus production. Even exposure to air pollution can cause an asthma flare-up. Lastly, stress. Intense emotions and worry can lead to rapid breathing and stress-induced asthma attacks. While it's impossible to avoid all stress, learning stress management techniques can be a valuable tool in preventing asthma exacerbations. Being aware of these triggers can help in preventing a severe asthma exacerbation. Knowledge is indeed power, and by understanding the common triggers, we can better manage and control severe asthma exacerbations, greatly improving quality of life and preventing life-threatening situations.